New York Reuters. As the landscape of COVID-19 vaccination evolves, U.S. health insurers are preparing to align their coverage policies with new federal recommendations. Industry sources indicate that while broad coverage for updated COVID-19 vaccines will likely continue through the fall, significant changes could be on the horizon, particularly for 2026, as policy decisions are increasingly influenced by shifting public health guidance. Current coverage and policy framework. Currently, most U.S. health insurers provide comprehensive, no-cost coverage for COVID-19 vaccines, including boosters, for all eligible individuals. This is mandated by the Affordable Care Act (ACA), which requires insurers to cover preventive services recommended by the Advisory Committee on Immunization Practices (ACIP) of the Centers for Disease Control and Prevention (CDC). These ACIP recommendations have historically served as the primary guide for vaccine coverage decisions across the industry, ensuring that vaccines are widely accessible as a critical public health measure. Potential shifts in vaccine guidance. Recent changes in the leadership of U.S. public health agencies have introduced a degree of uncertainty regarding future vaccine policy. A new administration has brought in officials, including a new CDC director and a new FDA commissioner, who have expressed a more cautious approach to broad vaccine recommendations. For instance, the FDA, under its new leadership, has narrowed its emergency use authorization for the latest COVID-19 vaccine to specific high-risk groups, including those aged 65 and older and individuals aged 6 months to 64 years with health conditions that increase the risk of severe disease. The U.S. Department of Health and Human Services (HHS) has clarified that others may still get the shots in consultation with their physicians, but this new guidance signals a shift away from universal recommendations. A spokesperson for America's Health Insurance Plans (AHIP), a leading industry trade association, confirmed that insurers will make future coverage decisions based on the latest scientific evidence and data. These determinations will be heavily influenced by the recommendations of the newly constituted ACIP. The spokesperson emphasized that the industry's goal is to ensure that coverage decisions are evidence-based and responsive to evolving medical consensus. Looking ahead to 2026,
while insurers are expected to maintain broad coverage for the remainder of this year, the real changes are anticipated for January 2026. This is when health plans introduce their new annual benefits and coverage policies for the entire year are finalized. The new ACIP's recommendations will be critical in shaping these plans. If the committee recommends a more limited vaccine schedule or focuses coverage on specific populations, insurers may adjust their benefits accordingly. For example, a spokesperson for Aetna, an insurer owned by CVS Health, stated that the company will continue to cover COVID-19 vaccines without cost sharing for its current plans. However, future coverage, particularly for 2026, will depend on the official guidance from public health agencies. Similarly, other major insurers, such as United Health Group and Cigna, are expected to follow suit, aligning their policies with the scientific and governmental recommendations. The evolving situation highlights a crucial intersection between public health policy and the private sector. The decisions made by public health leaders will directly impact how and to whom updated COVID-19 vaccines are available, potentially leading to a more targeted approach to vaccination in the coming years.